Hi, I'm Dr. Zane Hauk, Research Scientist at ZRT Laboratory, and today I'm going to talk to you about how you can optimize your health and promote resilience using ZRT's new wellness testing suite in a post-COVID world. ZRT has launched a new suite of wellness testing kits designed to help you better understand your overall health, track your fitness progress, or ensure optimal athletic performance. These kits will be very useful to help assess our health as we slowly come out of the COVID pandemic and start getting more active. In the following slides, I will discuss what these kits encompass and how they will help you understand your COVID risks, whether prior to your vaccination or recovering from an infection, and help you on your journey to improve your fitness or keep you operating at peak performance. How can the Wellness Suite help you stay healthy? It helps with your understanding of your risk of COVID. And it does this by looking at vitamin D, which is important for symptom severity. It is able to assess obesity and insulin resistance because these have impacts on hospitalization rate. And it looks at thyroid health because COVID can attack the thyroid. It allows you to track your health as you recover from an infection. Viral infections can raise cortisol, C-reactive protein, and also attack the thyroid. It allows us to monitor our health as we transition back to an active lifestyle, get a baseline of hormones and other factors to track our progress, and allows us to maintain peak athletic performance by keeping injury risk low and making sure hormones are primed for optimal training and race performance. So here's the full list of tests that are included in the Wellness Suite profiles, and I'm going to go through these individually and outline why each of them are important. So first we have estradiol. This is included in all three of the profiles. It is the main estrogenic hormone. It is important for bone mineral density, musculoskeletal health, which works by increasing muscle proteostasis, or the proper conformation of muscles. It increases sinew, collagen, and ligaments. This can be a double-edged sword, as this increases knee elasticity, which increases ACL tears, but it also decreases muscle strain and Achilles ruptures. Estradiol also participates in the anabolic stimuli response. Estrogen modulates innate and adaptive immune responses. It can limit the severity of inflammation due to the downregulation of NF-kappa B and also prevent the release of pro-inflammatory cytokines. It's been suggested that estrogen downregulates ACE2 receptors, which are one of the two receptors important for COVID infection. Next, we have progesterone. This is included in all three of the profiles. It is immunosuppressive and has anti-inflammatory effects. The progesterone receptor inhibits pro-inflammatory gene transcription, stimulates T-cell differentiation, and enhances IFN alpha. And in athletes, it's been shown that low progesterone and estradiol increase the risk and delay recovery from concussions, as well as high progesterone. The luteal phase can delay the onset of fatigue, but this high progesterone can also raise body temperatures and possibly lead to a thermoregulatory disadvantage. However, this is extremely rare and only happens in extreme climates. Testosterone and DHEAS are included in all three of the profiles. DHEAS reduces recovery time, protects joints and bones, increases stamina, reduces bad cholesterol and increases good cholesterol, neutralizes the effects of cortisol, which I'll talk about in a little bit. Testosterone is the main androgenic hormone. It's important in both males and females. It's anabolic, meaning it builds things up. It's important for muscle protein synthesis, bone mass, and red blood cell production. It's also been shown to upregulate TMPRSS2 transcription, and TMPRSS2 is the other receptor that's responsible for COVID activation and entry into the cell. Next, we have the sex hormone binding globulin, or SHBG. This is found in the fitness metrics profile only, and that's because that's the only profile that looks at the hormones in blood rather than saliva. And so if we're going to look at hormones in blood, it's really important to look at SHBG as well, because it binds free steroids in the blood for storage and transport. It binds very strongly with testosterone and essentially inactivates it, and it also affects the bioavailability of all the other steroids. Decreased steroid levels along with increased SHBG can be a sign of overtraining, which essentially means your body's not getting enough rest and recovery in between workouts. Next is cortisol. We test for this in all three profiles. It is the stress hormone and is catabolic, meaning it breaks things down. It's released in response to the fight or flight reflex. It's usually released in short bursts, but increased stress of physical activity or infection can make these bursts longer, decreasing the body's sensitivity to the cortisol and inducing long-term effects such as reduced protein synthesis, increased abdominal fat, and suppressed steroid levels such as estradiol, progesterone, testosterone, DHEA, and growth hormone. Cortisol should follow a circadian pattern, and changes to this can affect performance and indicate overtraining. This is because chronically high cortisol is immunosuppressive and will hinder muscle building and recovery. COVID infection raises cortisol levels, so it's important to make sure cortisol levels have returned back to baseline after a COVID infection before beginning a training regimen. And since COVID increases cortisol, people with already high cortisol prior to infection have higher mortality rates. Next, we have the thyroid hormones. These are included in all three of the profiles, and this includes TSH, free T3, free T4, as well as thyroid peroxidase antibodies. Thyroid hormones regulate energy and size and performance of muscles, including the most important muscle of all, the heart. Thyroid must be working properly to keep levels normal during workouts, because cortisol and adrenaline reduce the thyroid's ability, and both of these are elevated in response to training. Underactive thyroids can reduce blood volume pumped by the heart, slow down muscle recovery, and decrease muscle contractions. So again, this negatively impacts athletic performance. Thyroid is really important in recovering from injury. TSH and T4 decrease after endurance sports and can take a few days to recover and return back to normal. So it's really important to understand how your body responds to these types of activities. COVID has been shown to attack the thyroid due to its expression of ACE2 and TMPRSS2 receptors. Most cases of COVID result in decreased TSH values. However, the difference is in the other hormones such as T3 and T4. So hypothyroidism presents itself as low T3 and low T4 along with the low TSH. Non-severe cases of COVID have shown to have the low TSH with elevated T3 and T4, and this is very similar to hyperthyroidism. Patients hospitalized with COVID, whether it's a moderate or severe case, present with low free T3 and high T4, leading to thyroid toxicosis, which is excess thyroid hormone at the tissue level. Now, the good news is most patients' thyroid hormones do return to normal after 3 months recovering from COVID. But if you have recovered, it is important to understand how your thyroid is functioning before beginning or returning to a workout routine. Next is vitamin D. This is included in all three profiles because this is the most overlooked and undervalued hormone. Yes, vitamin D is actually a hormone. And interesting fact, over 50% of athletes actually have insufficient vitamin D. And now you might think this is a little counterintuitive, as a lot of athletes train outdoors, get a lot of sunshine, but athletes also require a lot more vitamin D due to its role in the body. And these roles include things such as skeletal muscle strength and function, muscle repair and recovery, protein synthesis, the inflammatory response, bone health, immune regulation, and cell growth. It is also extremely important when recovering from injury. Studies have shown that vitamin D status is a key indicator of the severity of COVID infections, with more deficient patients being hospitalized at a higher rate. Now, with that being said, vitamin D won't prevent you from getting COVID, but it could hopefully help reduce the symptomology and hopefully keep people out of the hospital. Next is insulin, hemoglobin A1C, and blood lipids. These are included in all three of the profiles. Studies have shown that diabetes increases the risk of severe COVID symptoms. Insulin resistance increases ACE2 receptor expression and increases the ability of COVID to injure the cell. Insulin resistance also leads to obesity, and obesity has been linked to increased incidences of hospitalizations due to COVID. However, obesity does not increase the risk of death from COVID. And then the blood lipids help give kind of a deeper understanding into the possible reasons for this possible insulin resistance or weight gain. Next is high sensitivity C-reactive protein. C-reactive protein can predict COVID infection severity. Increased C-reactive protein can be an indicator of potential injury or increased risk of injury. An increased C-reactive protein can be indicative of overtraining syndrome, meaning you need more rest and recovery between workouts. And finally, we have luteinizing hormone. This one is found only in the fitness and elite athlete profiles. It's produced by the pituitary gland, and it's an integral part of the menstrual cycle. In men, increases in LH lead to increases in testosterone production. And the testes have been shown to have ACE2 receptors, but studies have shown that COVID increases serum LH levels, but this increase in LH does not affect testosterone levels, possibly due to the ACE2 receptors found in the testes. And so what this does is it increases the LH testosterone ratio. And it's really important to make sure this ratio normalizes again after COVID infection before resuming a training regimen, or you're not really going to get much out of your workout because the testosterone is just not going to be active and it's not going to be available to get to the cells and do what it needs to do. So we hear a lot in the news about long COVID, and so what exactly is it? So most people who get COVID recover within weeks or a few months. Some will suffer chronic damage to the lungs, heart, kidneys, or brain, and others will develop long COVID. It's estimated that about 1 in 10 people actually suffer from long COVID. In a UK study, 1 in 10 patients that required intensive care, and 29% of those patients that received the intensive care were actually readmitted back to the hospital, and 12% of those actually later died after release. There's a higher incidence of diabetes, cardiovascular events, chronic kidney disease, and chronic liver disease in these patients. And while there's no formal definition for long COVID, it's generally defined as not having returned to pre-COVID health after 6 months and having symptoms that suggest that you're suffering from long COVID, but showing no signs of permanent damage to the heart, lungs, and kidneys. Now, these symptoms include things like fatigue, shortness of breath, cough, body aches, brain fog, depression, headaches, fevers, which may come and go, and an inability to exercise. Dr. Fauci has suggested that long COVID could actually be similar to or the same as myalgic encephalomyelitis or chronic fatigue syndrome. And this is actually triggered by other infectious diseases as well, such as Lyme disease or the previous SARS-CoV-1. Now, what can cause these symptoms? People aren't really sure, but they think it can maybe be ongoing low-level inflammation in the brain, autoimmune conditions that causes antibodies to attack the brain, decreased blood flow to the brain, or difficulty making energy molecules. A lot of these symptoms also are indicative of issues with the thyroid, so it's possible because COVID attacks the thyroid that this could be something to do with long COVID as well, but more studies need to be done to determine that. Now, C-reactive protein could be a good indicator after getting a COVID infection to determine your likelihood of developing long COVID. That's because C-reactive protein is a marker for dementia and other late-life cognitive impairments, so it's a really good predictor of brain inflammation. So if it truly is this inflammation in the brain or antibodies attacking the brain, there should be elevated C-reactive protein to kind of indicate that long COVID might be around the corner. So these profiles test in saliva and dried blood spot. The wellness metrics and elite athlete metrics test the actual hormones in saliva and test everything out in blood spot, whereas the fitness metrics actually test just everything in blood spot. So what are the advantages of saliva and blood spot testing? It's convenient sample collection at home, so you don't require a phlebotomist to either spit in a tube or prick your finger and collect a dried blood spot right at home in your pajamas. It allows for easy shipment of samples from the home to the lab. The samples are stable for several weeks at room temperature, and they've also shown excellent correlations with serum and plasma assays. It is also the only two methods that allow for accurate hormone levels when using topical hormones. So when you look at urine or serum, this can lead to overdosing due to the pharmacokinetic distribution of topically delivered steroids. And saliva and blood spot also more closely resemble hormones available to tissues. This is why I prefer this when looking at athlete testing, so you can kind of see what's actually happening at the cells and what's being delivered to the cells and the muscles. So who benefits from wellness metrics profile testing? Individuals with excessive fatigue, weight gain, especially in the waist, sugar cravings, chronic stress, a low sex drive, previous COVID infections, or people in the high-risk group for COVID morbidities. Also women with premenopausal symptoms of estrogen excess or progesterone deficiency, menstrual bleeding abnormalities, infertility, excessive facial body hair, menopausal symptoms, hair loss, or diagnosed with PCOS. The fitness profile testing benefits people who are looking to start a fitness program, interested in losing weight, or monitor their fitness or weight loss goals. And the elite athlete profile testing benefits individuals who train for competitions, compete at a high level, feel like they're hitting a wall, or in other words, that is overtraining, suffer from nagging or persistent injuries, or just are interested in seeing how their workouts affect their hormones. In conclusion, the new wellness suite from ZRT is here to help better individualize our testing needs. The wellness metrics is good for looking at our overall general view of the health, can predict severity of COVID based on our health level, and help determine our recovery from a COVID infection. Fitness metrics assesses your health improvements throughout a workout plan. This is helpful as we transition out of the COVID pandemic and start getting active again and track these health improvements. And elite athlete metrics tracks hormonal changes to ensure optimal performance and keeping injury risk low. This is for those who have continued training during the pandemic and are ready to return to in-person racing, like me, and to also make sure you're getting most out of the workouts and your body is primed for race day. Thank you for choosing ZRT and have a great day.